Okay, so we're going to now look at active, passive and strength movements for wrist and hand. So I'm going to show passive and strength and just assume that you can do the same with the active movements. First of all, if we take the wrist, obviously we have flexion and extension. We also have ulnar deviation and radial deviation. So these are obviously passive movements at the moment. We can extend and flex fingers. We can abduct and adduct the thumb, and we can also perform opposition movements with fingers and thumb. If we then move on to strength movements, I would stabilise the wrist like so and just put my hand in Jade's palm of her hand like so, and ask her to draw her hand upwards to flex and relax, and then put my hand round the back to ask her to extend the wrist and relax. Okay. For ulnar deviation, I'll put my hand here and just ask Jade to move across in that direction and relax, and then just push across in this direction. So here we're obviously testing four main aspects, and we kind of look at the forearm and refer to the flexor aspect, the extensor aspect, the ulnar and the radial aspects of the forearm. If we do resisted movements, first of all resisted extension. Jade, can you just try and straighten your finger out please and relax, and then if we extend and ask you to try and flex your finger and relax. And again we can do that through each of the fingers. For abduction, if you just push your thumb out against mine and relax, and then if we take it out and pull in like so. And for resisted movements, Jade can just do pushing against, bringing the thumb and forefinger together first of all, and then pushing outwards. Okay. Okay. So if we move on to some special tests now, just a general test of the integrity of the ligaments between the forearm bones, and so I'm going to grasp close to the styloid processes of both the radius and ulnar, and the other hand's going to grasp across the first row of carpal bones, and I will just do a movement. I'm trying to raise up and down to do a shift test in that joint there. I will then move forward one stage and grasp the first row of carpal bones, and then with the other hand, second row, and do a similar movement there. So any sprains or anything like that between these bones, hopefully we'll find out from these tests. We'll then move on to individual joints between the carpals and metacarpals. So I would stabilise here, palpate to feel the fifth metacarpal, stabilise the carpals and just move up and down like so, and you can see a little bit of that movement. Move across, do the same on the fourth metacarpal, and move across like so, and check each of these and finishing with the thumb. We then move on to the metacarpal phalangeal joints. We can do similar movements here, but because we've got a little bit more latitude, we can do some additional movements. So we would shift up and down first of all, but we will also grasp the finger and just do a twisting movement which will help check the collateral ligaments. Move across, again stabilise metacarpal, rotate and shift up and down. And we will do the same through each of the interphalangeal joints, so the proximal and distal. Same movements, up and down, rotate, and again that will check all of the ligaments around all of those joints. If we're doing percussion tests for checking for fractures, we would ask the client to keep the fingers straight first of all, and just do a flicking action gently at first if we suspect there's a fracture there, and then perhaps with a little bit more force, flicking the ends of the fingers, causing vibrations to go through the bones and checking for any possible fracture or stress fracture that might be there. We would then bend the finger like so, at the proximal interphalangeal joint and do the same test. And we can work along all of the knuckles like so. And then the metacarpal phalangeal joints, again similar percussion tests, checking all of those as we go. If we want to check for circulation, we would check with using what we call the Allen's test. So we will find the channels here for both the radial and ulnar arteries feeding the hand, and if I just compress on those and ask Jade to clench her fist, open, clench, open, you can see fairly quickly how the blood empties from the hand, and just stop there with your hand open, and then if I release the radial artery we can see the blood flow back into the hand, and Jade will no doubt feel a sort of warm sensation as that happens. So we can check both arteries there.